Hello, I'm Dr. Ben Newman. This is Ask Dr. Ben. I'm going to try to answer your questions about COVID-19 or whatever. Yeah. Using science, which is what I do. Okay, so the next question is from Ruben. All right, how you doing, Ruben? Let's see. Is there any research addressing the effectiveness of the booster shot if the interval, between the first and second shots is longer than the CDC recommendation of 42 days? Yes. The answer is I have not seen it, but I know that there are several countries that are exploring this and are doing it, and I don't see why it wouldn't work. So, what we know now is that there are studies out that show that the two-dose vaccines, I believe they tested the AstraZeneca and the Pfizer, can work and give good protection for at least 2 months in even very old people with very low side effects with only one dose. So a two-dose vaccine can be used as a one-dose vaccine, and that's probably okay. The vaccines were approved using the protocol that the company tried. So they picked something that they thought would work and that they thought would probably get them a result reasonably quickly so that they could get this out to people and start protecting people and ending this. So they didn't try all the things that they could have tried. They tried the thing that they thought would work best. And so you've got slightly different protocols from different companies. And governments around the world are taking a kind of a liberal view on, like, when they're doing the initial trials, they would try to get all of the second doses right at 21 days for one of them, or right at 28 days, plus or minus a couple days, when people, don't show up, or when it's a weekend or something like that. And so, yeah. There is a growing body of literature that shows you can use the vaccines in different ways. And if you can get protection from one vaccine that's still okay, then probably, I think we should be looking at maybe a little bit longer space between the first vaccine and the second one. Because the second one is there to boost. So it's to give you more immunity that's then going to last you longer and go down maybe a little, slowly, but from a higher point. And so really the optimal use of these vaccines is to get the first one up so that you are protected, and then just before you go out of protection, or before anybody goes out of protection, you want to have that second vaccine that boosts you up to a higher level, and then works for longer. Getting the exact timing right, it's going to be different for every person. And so they are trying to come up with guidelines that'll usually work for a lot of people, and probably they could go longer between the two doses. So I don't think you need to worry. I think you may have even got lucky if you got them a little farther apart. You may end up with a couple extra days worth of immunity when we get to the end of what the second dose did for you compared to what you would have had otherwise. And that sounds like a good thing to me. This is an area of ongoing research. There isn't really a consensus, except to say that these are good enough vaccines that they work under a variety of conditions, which is very, very positive news. So, thank you for an excellent question, and this has been Ask Dr. Ben.